All right, BSI is my senior safe. How many patients do I have?
One.
Okay, my mechanism of injury is a ATV accident with the separation of the rider. Okay, I'm going to go ahead and call for ALS backup. Take C-spine control of my patient. Check responsive. Hey, can you hear me?
Unresponsive.
I have an unresponsive trauma patient. My general impression is 4. I'm going to go ahead and open his airway using a modified jaw thrust. I'm going to look, listen, and feel for respiration.
8 in shower.
I'm going to insert an OPA, high flow 215 liters per minute by back valve mask. I will turn C-spine and airway control over to my partner.
They haven't.
I'm going to expose my patient's chest. I'm going to check for equal rise and fall and any life-threatening injuries.
We have paradox movement on the left.
I'm going to apply bulky dressing and secure it in place. I'm going to check my patient's pulses at the radial and the carotid.
140 liters.
I'm going to check his skin color and condition.
Full exam.
Okay, I will now do a rapid blood scan. Check for any blood, any blood, any blood, any blood, any blood, any blood. I'm going to expose his extremity. Any blood, any blood.
Blood.
What kind of blood?
Dark blue.
I'm going to note it. Any blood, any blood. I'm going to expose his extremity.
Blood.
What kind of blood?
Right red is where
Apply direct pressure to bleeding control.
Control.
I'm going to bandage it, move on. Any blood, any blood, any blood. I'm going to expose his extremity.
Blood.
Blood, what kind?
Copious amounts.
Okay, I'm going to go ahead and apply direct pressure.
9.
I'm going to apply additional dressing.
Control.
I'm going to bandage it. Any blood, any blood. I'm going to expose this extremity. Any blood, any blood, any blood. I have a high priority patient. I'm going to get my patient ready for transport. I'm going to do a rapid trauma assessment. I'm going to palpate the back of his neck, measure and apply an appropriate size C-collar. On a headman's count, we're going to log roll the patient. 1, 2, 3. Check his back.
See multiple abrasions.
Noted buttocks and posterior legs. I'm going to log roll him onto the spine board. I'm going to secure knees, navel, nipple, the head last. I'm going to load him in the ambulance. I'm going to send my partner to get a sample history. I'm going to obtain baseline vitals.
Blood pressure is 60 over 30.
Okay. En route to the hospital, I will do a detailed physical exam. I'm going to start with the head. I'm going to check for any deformity, abrasions, contusions. I'm going to check his ears for any seepage or blood, battle signs behind the ears. Check his eyes for pearl, raccoon eyes. Check his scalp, check his cheek, check his nose, check his mouth, any secretions or deformities, obstruction. I'm going to check his jaw. I'm going to check his neck for jugular vein distension or tracheal deviation. I'm going to palpate his clavicles. I'm going to palpate his chest. I'm going to also take lung sounds. I'm going to palpate the 4 quadrants of his abdomen.
We have rigidity.
I'm going to note it. I'm going to check his pelvis for stability. Male patient, I'm going to sweep for a priapism. I'm going to do a 4-point check in each extremity, checking for any deformities. I'm going to check a pulse. Can you feel me touching? Can you wiggle your fingers? Same thing on this patient. Check his elbow. Check for a pulse. Can you feel me touching? Can you wiggle your fingers? Check his lower extremities.
You have deformity.
Noted. Check his knee. Check his lower extremity. Pulse. Can you
Pulse
feel me
not
touching?
present.
Noted. Feel me touching you? Can you wiggle your toes? Check for any deformities. Knee. Check for pulse. Wiggle your toes. Can you feel me touching you? I will manage all secondary injuries. I will do my ongoing assessment. I'm going to repeat my initial assessment, my vital signs every 5 minutes. I'm going to reassess my interventions and my focus detail exam, and I'm done with this station.